Dear students, welcome to R.A.T.S, Racing Against Time for Students in Pathology. We start with a case history as usual. A 25 years old lady came to the medical OP with complaints of a low-grade fever. Please follow a low-grade fever, lassitude, and a swelling on the left side of the neck. She has had a similar presentation of self-limiting fever in the past. So what are the positive things? A fever, lassitude, swelling on the left side of neck. On examination, the swelling was discrete and rubbery in consistency. The X-ray revealed a mediastinal widening. What is your diagnosis? The X-ray of the patient showed this mediastinal widening. You can have a look at this one, see the extent to which it is getting widened. And the patient had a typical graph of the fever. There was a peak and then an ebb, again a peak, a rise and a fall. This was the pattern of fever. What is your diagnosis? Discuss the etiopathogenesis, histological classification, and morphology, and add a note on the staging and prognosis. I hope you people are clear with the diagnosis. It is Hodgkin's disease. Nowadays, people may use, may not use an apostrophe S. Think of the subheadings. The subheadings will take you to the answer. In this one, certain things such as the R.A.T.S cell by itself can be a question. So please do prepare for it. It can be an essay or a short note, an MCQ, a viva, and so on and so forth. On the screen, I am seeing a cell. It is multinucleated and there is a prominent eosinophilic nucleolus in each cell. See, there are multiple nuclei, prominent nucleoli, and this is the shape of the cell. So this is one variant of the R.A.T.S cell. But then this slide is meant for the brains behind. Thomas Hodgkin, who was the person who identified this particular disease, and Dorothy Reed, who identified the R.A.T.S cell. And why is it called the R.A.T.S cell? Because there is another person who has been there, Sternberg. So Reed-Sternberg cell and then Thomas Hodgkin are the brains behind the Hodgkin's disease. This is a classical picture. Sometimes a lymph node can be kept for the students. The lymph nodes are large, they are discrete. Discrete in the sense they can be separated easily. Whereas in the case of tuberculosis, there will be addition between the adjoining lymph nodes, which we call as matted. Here the lymph nodes are not matted, they are discrete. And usually an individual lymph node or a group of lymph nodes in one particular site will be affected. Later on, it can spread contiguously. So for example, if it is in the supraclavicular region, it can spread to the cervix, etc. They are rubbery in consistency. And look at this one, classical cut potato appearance. Some books will be giving you a fish flesh appearance also. So these all can be asked as questions. Where do you get a cut potato appearance, fish flesh appearance, etc.? Courtesy Wikimedia for this picture. And this is the pathogenesis, a very simple line diagram. I would like you people to kindly draw this. So there is a germinal center, and from that you have got a B cell. There can be various transforming events, including an Epstein-Barr virus. And this will get transformed into the R.A.T.S cell, which is a binucleate cell. We shall be repeatedly describing this. R.A.T.S cell. And by means of the cytokines, it can get progressed, and then there will be the inflammatory response. Today you have got the corona, because of which there are cytokines and there is a lot of inflammatory response. Similarly, in Hodgkin's also, it will be there. Or sometimes, touch wood, you may recover and the cells are lost by a process of apoptosis. So very simple diagram. I repeat it once again. Germinal center, B cell, and it is getting transformed by means of the Epstein-Barr virus, getting converted into the Reed-Sternberg cell, which can evoke the cytokines, as a result of which there can be a reactive inflammatory response with multiple cells. Sometimes the cell itself can be lost by apoptosis. This will be a pathogenesis. I would like you people to kindly draw that diagram. This is a normal picture which I would like you people to appreciate. So this is called a lymphoid follicle. In a lymph node, you find that there will be, I'm finding a pale area. This is because the cells are slightly larger and they are immature. As they mature, you find they get smaller. The nucleus is only prominent, as a result of which it is darker. So it is a typical lymphoid follicle. Immature cells, mature cells. And this is a structure seen in a lymph node. But then, why am I telling you people this? Look at this one. It is a case of Hodgkin's. I am not able to see the classical structure of a lymphoid follicle. It is totally lost. This is called an effacement of architecture. Architecture means it is the relationship of one part of a tissue to another. One part of a tissue to another, the relationship is called as architecture. Whereas here, I'm just finding sheets of cells. There are a couple of Reed-Sternberg cells. But then the arrangement, it is just in sheets. There is no particular pattern that could be made out. So architecture is totally lost. You will have to write this in your exam. So I would like you people to answer this. So this is a Reed-Sternberg cell and this is the reactive cells that can be there. There can be the histiocytes, the neutrophils, the lymphocytes, some are plasma cells, all can be seen. The architecture, as I had mentioned earlier, it is totally lost. Reed-Sternberg cell or the variants of the Reed-Sternberg cells are seen. What are the variants? We shall be seeing. So it is pleomorphic. Pleomorphic is not the pleomorphism that we use in malignancy. In malignancy means variation in size, shape and all is pleomorphic. But here you are finding different types of cells, hence you use the word pleomorphic. So there are lymphocytes, plasma cells, eosinophils, histiocytes. That is why it is called pleomorphic. There are multiple variants of this Reed-Sternberg cells. The classical cell, lacunar cell, polypoid cell, pleomorphic Reed-Sternberg cell, mummified cell. And please draw this diagram anywhere you want in Hodgkin's. It is a very simple line diagram which you can draw. It is the same picture over here. So it's a eosinophil in this case. So I think you people can draw this also. So the Hodgkin cell with the reactive cells. These are all the variants of the Reed-Sternberg cells. This I shall again show you. There are two different methods of classification. This is the old R.A.T.S classification. Lymphocyte predominant, lymphocyte depleted. Mixed cellularity, nodular sclerosis. So this is one. It is quite easy to remember. Predominant, depleted. Mixed cellularity, nodular sclerosis. Then there is a WHO classification. Here also it is the same. There is a classical Hodgkin's lymphoma. There can be a mixed cellularity, nodular sclerosis, lymphocyte rich and lymphocyte depleted. So this is one set of tumor. There is another one totally called as lymphocyte predominant. Probably this has got a slightly different way of behavior. So lymphocyte predominant has been taken. So both these classifications I would like you people to memorize. You'll have to write in your exam. And this is the tabular column that I had prepared, which I would like you people to kindly by heart and write. Not very difficult at all. This is a pattern of cells that I had shown earlier, the type of Hodgkin's, and these are all the cells that you see in each. Nodular sclerosis, for example, you find that there can be collagen bands, which are not found in others. Reed-Sternberg cells, again, there are different types of cells you'll have to mention. Because lacunar cells, I have mentioned in nodular sclerosis, this will be asked as an MCQ. This will be given to you as a clinical picture, occurring in young females. So what are all the clinical manifestations and prognosis? So usual thing is in nodular sclerosis, the prognosis is excellent. If it is lymphocyte predominant, it is better. If it is lymphocyte depleted, it is supposed to be poor. So this particular tabular column, kindly by heart. And this is what I had been describing, the Pell-Epstein type of fever. So a peak and a fall. Classical Pell-Epstein type of fever in Hodgkin's disease. A beautiful numerology which I had designed myself, I would like you people to kindly go through. Biphasic fever. Biphasic fever, there is a peak and a fall. Binucleated cell, the Reed-Sternberg cell. Bimodal peak. Bimodal means this is a younger age, maybe around the 20s and then 50s, 60s. There are two peaks for the Hodgkin's disease, so that is called as a bimodal peak. And there are two classical markers, 15 and 30. 15 into 2 is supposed to be 30. 45 is also there, but this we will remember for the time being. Two viruses, Epstein-Barr virus and HIV. Two appearances, cut potato appearance, fish flesh appearance. And two names, Dorothy Reed and Sternberg, in addition to Hodgkin. So this is very simple. Hope you people will be able to by heart, remember, and reproduce. The classical Reed-Sternberg cell, this we will have to describe. It is a large cell. There is no doubt at all. Look at these cells. You find that hardly there is any cytoplasm. A large cell, abundant cytoplasm. And these are the nuclei. The pale ones are the nuclei. This is the nuclear membrane. There are two of these. So one appears to be a mirror image of the other. So this is a classical mirror image appearance seen in the Reed-Sternberg cell. Nucleolus is pink in color. So this is classical. Owl-eyed appearance or a mirror image nucleus, the eosinophilic nucleoli are all classical of it. And this is one. I think you can compare the picture over here. The Reed-Sternberg cell is a classical one, which you people will have to describe. But then life is not so easy for the pathologists. Always we will not be seeing this binucleated cells. Sometimes we'll have to search, we'll be finding what is called as a mononuclear cell. This is a classical cell that I had already mentioned. Lacunar cell because there is a lacunae or emptiness around the cell. This is classically seen in the mediastinum in the nodular sclerosis in Hodgkin's. That is what I had told you people earlier. So there is a lacunae and hence it is called lacunar cell. It can be multinucleated. Look at the amount of number of nuclei that I can see, multinucleated. Popcorn cell. Popcorn cell in the sense is you find that it is somewhat irregular over here, something like a popcorn. The cell can be mononuclear, almost similar to this one. It can be mononuclear. And sometimes I cannot make out any of these things. It is just an outline. So we call it as a mummified cell. We call it as a mummified cell. So these are all the variants of the Reed-Sternberg cells. I would like you people to kindly remember this. What is the mnemonic for the Hodgkin's? HODGIKINS. Again, I happen to pick up tremendous work some students have been doing. H, HIV or Epstein-Barr virus. O, owl-eyed appearance. Mediastinum, D is over here. G, contiguous or contagious spread. So spreads by contiguity. K, kidney, there can be a nephrotic syndrome. I, bimodal, so the eye has to be stressed. N, nodal enlargement. Yes, it causes secondary amyloidosis. A superb mnemonic, nothing to beat this. And what are the clinical presentations? Pell-Epstein type of fever, biphasic presentation, lymphadenopathy, either a group or adjacent nodes, splenomegaly, hepatomegaly will be there. weight loss, and anemia. These are all not seen in all the cases, in all the stages. So when do they occur? So this is called the Ann Arbor staging. Stage 1, I find that there is a single node or a single group of node that is involved on one side of the diaphragm. So there is only single. Stage 2, I find that there can be two groups that are involved. In fact, there is three, but then all are found on the same side of the diaphragm. So it is stage 2. Stage 3, on either side of the diaphragm. Stage 4, there can be organomegaly, or there can be the pelvic metastasis, bone metastasis, stage 4. Sometimes you can also have an organomegaly and a lymph node enlargement, but on the same side of the diaphragm. So this is called the Ann Arbor staging, and this is used to decide the progress of the disease. Mnemonics, I told you, and the biphasic. This is supposed to be a summary of it. Kindly go through, and I would like you people to be thanked. Gracias.